you please go over the follow-up visits I need after skin cancer is removed and any treatment is completed?
After somebody's been diagnosed with a skin cancer, follow-up should include pretty much lifelong continuation with dermatology. And again, that gets back to the risk of developing an additional skin cancer later in life. So it's important to have what we call skin surveillance. So that is a dermatologist or dermatology provider, such as a nurse practitioner or physician assistant, that are performing clinical skin exams. And those will typically happen anywhere between every 3 to every 12 months. It depends on risk. If you are an individual who's had a number of melanomas or a number of non-melanoma skin cancers, your risk remains higher than somebody who may have had one basal cell cancer in their life. So for somebody who's very low risk for developing another skin cancer, or it's been decades since there's been that development, a dermatologist or primary care physician may feel comfortable following you once a year. For individuals that have additional risk factors such as light skin, red hair, or a first-degree relative that's been diagnosed with a melanoma, which we know is a risk, then we typically recommend that follow-up is every 3 to 6 months for at least 2 to 3 years from the time that the skin cancer was diagnosed. And then, depending on risk again, those intervals may be increased every 6 months. But as a general rule, anybody diagnosed with a skin cancer or at risk for skin cancer should anticipate to be followed by dermatology lifelong. And again, the intervals of when that person may be seen will vary from person to person.